Hi, my name is Cassidy Tyler, and I will be discussing the discrimination against people with HIV and/or AIDS. HIV stands for Human Immunodeficiency Virus. HIV destroys CD4 plus cells, a type of white blood cell that helps us fight off infections in our body. CD4 plus cells are found in your immune system, so when the HIV virus destroys these cells, it actually weakens our immune system. The immune system is very important to us because it helps us fight off diseases such as HIV and cancer. According to the Center for Disease Control and Prevention, more than 44,000 people were diagnosed with HIV as of 2014. The numbers steadily increase each year. HIV is spread through blood and bodily fluids such as semen and vaginal fluids. AIDS means acquired immunodeficiency syndrome, and it is the most advanced stage of HIV infection. HIV can be treated by taking medicines to help stop HIV from making copies of itself and further destroying the immune system. For my first source, according to the Journal of the International AIDS Society, written by Laura Nyblade in 2006, unfortunately, the health sector is one of the main settings where HIV-positive individuals and those perceived to be infected experience stigma and discrimination. A stigma is a mark of disgrace associated with a particular circumstance, quality, or person. This means the medical setting is where people with HIV are most often discriminated against. This is odd, right? But it's true. Doctors and healthcare professionals often gossip or verbally harass patients who they see who have HIV. Some doctors even deny to treat patients because they are scared that they will contract the disease from them. It can be very tough for a person with HIV or AIDS to get medical treatment, a job, or even live in a community. Most people will believe that if they work with a person who has HIV, or if they breathe the same air as a person, touch the same objects, anything like that, they think that they can contract the disease, and that is false. The only way that you can contract HIV is from contact with blood or bodily fluids of a person that has been infected. So breathing the same air as someone, or drinking after them, or touching something that they've touched will not give you HIV. And many people think that it will. That's why they're scared to work with someone, or if someone wants to rent an apartment and it's someone else's, they don't want them to rent their apartment because they don't want the person with HIV to touch the things in that apartment, and then they have to touch it because they think they can get it, but it's not true. I actually know a doctor who has AIDS, and he works in the labor and delivery field, or he works in the labor and delivery section of the hospital, and he actually tells his patients before he works with them that he has AIDS. He got it from when he was delivering a baby, and the woman had AIDS, and her blood splashed in his eye. And he doesn't have to let his patients know, but he does, and most of them switch because they're scared to work with for a person to deliver their baby that has AIDS because they don't want to get it. For my second source, according to the American Medical Association Journal of Ethics by B.D. Anderson in 2009, HIV is different from many other diseases. Finding out one has HIV presents complex physical, emotional, social, and legal concerns that do not arise when one is tested for other communicable diseases. In 2009, a national survey was conducted by the Kaiser Family Foundation. They found out that 1/3 of Americans believe that HIV could be transmitted by sharing a drinking glass, touching a toilet seat, or even swimming in the same pool with a person who has HIV. All of these are persistent misconceptions. According to Anderson, it should be reasonable to assume that one group of Americans, that those who provide health care, doctors, nurses, do not share such misconceptions and do not discriminate against or stigmatize people with HIV, but regrettably that assumption is incorrect. Many doctors and nurses, if they're working with someone who has HIV, they're going to discriminate against them or talk bad about them, or in some cases they'll even go tell their family and go tell other people, and then it'll get spread on and on and on until everybody knows about it, and that is very illegal to share that kind of information with someone else. Healthcare facilities are one of the main places that discriminate against people with HIV because a lot of times in the healthcare field, you do have to deal with someone's blood and bodily fluids, and they're scared that they will contract the disease from them. A lot of court cases have actually been filed because of this discrimination and the lack of treatment that they get from medical professionals. For my third source, according to the National Institute of Health in 2008, in South Africa, those who experienced stigma or discrimination were less likely to disclose their HIV status to their sexual partner, and non-disclosure was associated with transmission risk transmission risk behavior. And basically this means that if someone was discriminated against for having HIV, it means that they're less likely to go tell the partner that they're with, their sexual partner, that they have HIV because they're scared that they won't want to be with them anymore because they have HIV and they don't want to get it. So they're going to be less likely to tell that person that they actually have HIV, which means they're going to spread it to them when they have sexual contact, and that person won't even know they have HIV. So if they go off with someone else and do the same thing, that person will have HIV too, and they'll go with someone else and they'll have HIV, and it keeps spreading and spreading along a long line of people. And so that makes many people not want to tell their partner that they have HIV. And that means it's going to travel along, and that's how it gets spread. It's also very hard for people with HIV to have relationships, not just sexual activity with someone, but relationships, because if you tell your partner that you have HIV, it's going to make them not want to be with you, because most people think that people with HIV are nasty or gross, and that's not true. Maybe they got it by accident, like the doctor I know. He didn't mean to get AIDS, but when the lady's blood splashed in his eye, he got it. But that makes people not want to have anything to do with him. And I think if everyone were to increase our knowledge on AIDS and how it's spread by bodily fluids only, then it would decrease a lot of discrimination against those who have HIV and have to live with it, and it would make life a lot easier for them, because if people really knew that it was only spread through blood and bodily fluids, they could more easily get jobs, and they could live in communities and have contact with their family. And some people's families don't even want to have anything to do with them if they have AIDS because they don't want to get it. And I just think that we should increase our knowledge on AIDS and HIV, and it will decrease a lot of this discrimination. Thank you.